Hello, future RMTs. Welcome again to our online class. And in this lecture, what we're going to discuss is all about the principles of clinical chemistry automation. Okay, as you can see, I am not showing my face today because it seems that I am becoming distraction every time that you are going to watch this video. So I decided not to show my face anymore, myself anymore, kasi baka nakaka-distract na lang ako habang pinanonood nyo or baka pinagtatawanan nyo na lang ako. So I decided not to include myself anymore. Well, anyway, since we have discussed already the first part of this, I will just have a run through of what we have discussed in our synchronous session for this video. Okay. Again, automation allows or permits the operators to focus on manual processes and increase the efficiency as well as the capacity of testing. So we have agreed before that, yes, that's correct. No? It increases the capacity of testing because it made our life easier. It made our processes in the clinical section or in the clinical laboratory section fast because we don't have to waste too much time or we don't have to spend too much time in making this test possible because we have these machines that will help us to do our test, not to do our analysis. However, like what I keep on telling, now I want you still to know the basic one or the manual one, and I don't want you to rely mainly on what is the result given by your by your equipment or machine because you have to check it also. You have to verify if that's really the result. Okay, and remember that automation allows the focus on gives focus on it allows the medical technologists to give focus on the manual technique. I will not go deeper on that because we have discussed that before. And before we proceed to our next discussion, I want you to take note that there are four or three rather. There are three analytical processes involved in the clinical laboratory, such as the pre-analytical, the, the analytical, and the post-analytical phase. Okay? So we have here the first automated analyzer, which was introduced by Technicon in the year 1957. Again, this automated analyzer is known as the auto analyzer, which is a continuous flow, single channel, and sequential batch analyzer. Again, when we said continuous flow, the liquids are pumped through a system of continuous tubing, meaning to say the liquid are pumped through a continuous flow. And samples are introduced based on and take note, guys, that first automated analyzer or the auto analyzer is capable of performing a single test at a rate of 430 samples per hour. Okay. Next is we have the second generation or the simultaneous multiple analyzer, which allows the testing of 6 to 12 tests per sample or simultaneously at a rate of 360 to 720 tests per hour, which is much more efficient than the analyzer. Okay. And remember, we have here the SMA6 and the SMA12, which are both capable of multiple channels for different testing. Okay. Of course, we have here the first commercial centrifugal analyzer, which was introduced in the year 1970 by the NASA Space Research. No, the downgrade or the downside of this first commercially centrifugal analyzer is that it has a significant carryover problem, which costs too much, no, and the costly of the reagent waste. Okay, again, when we said carry over, the possibility of having a contamination from one sample to another because of the failure to pump or to cleanse or rinse the roads prior to the next sample. Next is we have the automatic clinical analyzer, which was introduced in the year 1970 by DuPont. Okay, take note, guys, that DuPont is now known as the Siemens. Since we have the problem in continuous tubing and carryover, no automatic clinical analyzer was able to produce or to introduce something that will help us to eliminate the possibility of having a carryover. Thus, they introduce rather, no, pasensya na, they introduce what we call the non-continuous flow. Okay, non-continuous flow, what is this? We said that non-continuous flow uses random access fluid. And when we said random access fluid, it uses hydrofluorocarbon liquid to reduce the surface tension between samples and reagent to eliminate the possibility of having a carryover. Now, remember also guys that clinical automatic clinical analyzer was able the first analyzer that was is capable, I'm sorry, that is capable for stat analysis, no? Like what we have said in the first three equipment or analyzer, no? They can run 40 samples per hour, 300 to 700 samples per hour, simultaneously 6 to 12 tests yung second generation. No, but you cannot select the test that will be run on the stat basis or stat, no. But in automatic clinical analyzer, we are capable to do the stat analysis because of its random access capability. Okay, all those equipments that was introduced in the first two slides are all examples of what we call liquid chemistry, now which uses liquid reagent for it to be for the analysis, no? And in the year 1970, thin film analysis technology was introduced through the use of what we call the dry chemistry. Okay, the Kodak et Kakem analyzer introduced in the year 1978, and take note that Kodak et Tachem analyzer is now known as the VETROS or the ortho diagnostic or the ortho clinical diagnostic. This is the first clinical analyzer is that was introduced, no, using the technology of using the technology of dry chemistry. Okay, this is the first instrument to use microsamples, volume, and reagent. Ano pong ibig sabihin? It has a micropipettor tips on the machine that will aspirate sample. No, a very small amount of sample or microsample is required. Unlike the other analyzer, which will require you too much of the sample, no? And then instead of having a liquid reagent, no, it uses thin slides or micro slides, no, for analysis. Thus, it is what we call the dry chemistry, no? And remember, this is the first instrument to incorporate computer technology extensively into its design and use. So since technology is evolving and developing, we develop or scientists develop or medical technologists develop an analyzer which uses an ion selective electrode. No? Ion selective electrode will be discussed in our next video, which is the analytical principles, analytical techniques. Okay? And it is more sophisticated because it is able to use computer hardware and software for data handling. And it has a larger test menu no, um, which allows more tests to be conducted or to be done using this specific analyzer. Okay? So what are the recent advances in the field of automation and the field of chemistry? We have the point of care testing or the benchtop analyzer. I have asked you a question during our synchronous session if there will be an effect, no, in the manpower if we will have the implement or if we will use, no, if the patients will all of the patients will use the point of care testing, the POCT, because POCT is can be done on the bedside, no? Yun ang napag-usapan natin. Example nga nung pinag-usapan natin is the use of glucometer. However, no, the problem in the use of POCT, although it requires also quality control and assurance program, no, sometimes the QC was not or were not be performed, no? Kaya po we cannot test or we cannot justify the integrity of point of care testing. Again, take note that POCT also requires quality control. However, there are times that hindi na po perform because, since it's portable, easy to use, no, the assumption of the patient and the assumption of the people who are using this is, why do I have to do that if this is a portable? No, and another problem with that is the example that you had is the chronometer uses what? It uses a battery. It's a battery operated. So meaning to say, If the machine or if the battery has a low energy na or mababa na yung supply niya ng energy, it is prone to error. We also have what we call the immunohistochemistry or immunochemistry analyzers or analyzers. I'm sorry, which is capable of assaying drugs, specific proteins, tumor markers, and hormones. So I will not go deeper on that because we have discussed that already in our synchronous session. So I will start our discussion with driving forces towards automation. So why do we have to do the automation? What are the reasons why hospitals are engaging themselves into uh, automation? No, like what I've said in our synchronous session, most of the laboratories are using the word fully automated as their marketing strategy to attract more patients, to attract more customers. Since from the word start automated, it means that it is much more reliable than the conventional one. Now, we have here six reasons or six forces why we have or why laboratories adopt automation. Number one is the higher volume of testing and faster turnaround time. In our synchronous session, I was able, no, I assume and I still remember that I was able to give you an overview on how manual testing is being done, especially in the chemistry section. Assuming that we have those things in nowadays, no, do you think gaano kadaming samples ang matetest natin? Or considering the fact that we have here the pandemic, we are experiencing the pandemic, and if we are going to amplify, if we are going to extract, if we are going to denature protein in a very obsolete way or in a conventional way, baka yung backlog natin in the testing still, no? Ganun pa din kataas. Now that's one reason why we have to do the automation to lessen the turnaround time. Again, take note that turnaround time is the time between the requisition has been made by the attending physician until the time that the result has been received. Okay, that's the turnaround time. And I still remember my question to you, why is it that turnaround time in the clinical chemistry section ay mahaba? No? Clinical chemistry section yung isa sa pinakamahabang turnaround time. Well, of course, except for microbiology section, which can be as long as 7 days, depending on the program or the culturing method na gagamitin. While in chemistry, we have a long turnaround time or approximately 2 hours turnaround time. It's because of we have to prepare the sample, we have to centrifuge the sample, we have to separate the serum and the red cells, no? We have to load it in the sample in the machine. And like what of your batchmate said, we run tests in chemistry by batch. What is the purpose or why we run tests in chemistry by batch? No? Para po hindi masyadong sayang sa ating reagent. Hey, so that is one of the reason why we have to do automation. Next is fewer, more centralized core labs. Mas madali yung ginagawa mo. Centralized ka na. No? Isang machine ang ginagamit mo for all the tests. Declining the use of lab panels or profiles. Ano ba yung mga lab panels na yun or profiles? These are the tests that is being used to assess, let's say for example, liver profile. If you're going to do a profile at once, no, using a conventional technique or the manual technique, na masyadong matagal. At since bumababa na nga yung demand sa laboratory profiles or laboratory test profiles or panels, we must adapt new thing or we must adapt new procedure in order to increase, no? In order to increase the capacity to perform all those things, to perform all those tests. And the answer to that is the automation. Next is because of the regulatory standards requiring greater accuracy and precision. Di ba sabi ko sa inyo, we have what we call the National Quality Assurance Program or the National External Quality Assurance, no, Bisaya man, assurance scheme, which no, maintains the accuracy and the precision or the reliability of the results in the chemistry section, not only in the chemistry section, but in the whole laboratory. No, and I want you to take note that the answer in my question about the reference laboratory for chemistry section is the Lung Center of the Philippines. Okay, Lung Center of the Philippines is the National Reference Laboratory or the NRL for the clinical chemistry section. Okay, Intense competition among instrument manufacturers is another reason. And we have here decreased operating budgets for laboratory. No, although it's costly to acquire machine equipment because it costs million. No, hindi lang siya thousand, million yan. One time, big time naman siya. Kapag po nabili mo siya, no, mabilis naman yung return of investment na tinatawag or yung tinatawag nating ROI. Okay? Now, what are the advantages of automation? Number one, increases the test performed in the laboratory. Yan. Siyempre, given na yan, yung sinabi natin kanina, increase the capacity. So, ibig sabihin, mas tataas yung mga daming test na ginagawa mo. Mas maraming test na nagawa, mas malaking income. Di ba? Mas mataas, mas madaming test ang kaya mong i-perform in a day, which means more income. Okay? Next is decreased labor cost and cost per test. Not really a significant advantage for automation because, like what we have said, no, human power or manpower will always be there. Yun nga lang, uh, the number of duty or the number of staff na mag-duty in a certain shift can be lessened. Unlike if you will have the full manual technique and you will need approximately at least two, no, at least two medical technologists doing the test. Okay? Next, minimizes variation in the result among laboratorians. Okay? Kung natatandaan nyo yung sinabi ko sa inyo, yung isa sa pinagmumulan ng palpak na bagay sa laboratory, not the process, not the procedure, not the manual operating procedure, but the medical technologists who are doing the test. Okay? Yun yung mismong kauna-unahang dahilan kung bakit nagkakaroon ng problem in the analysis, most especially if we're doing the test in a manual method. So, with the use of automation, it allows us to lessen the variation among the medical technologies. No? In clinical chemistry, we have in clinical microscopy rather, uh, one of the tests in clinical microscopy is the urinalysis or the microscopic examination of the urine, wherein some laboratories are still offering manual one because you have to do that. We have to stick on the manual one because there are some hospitals or laboratories na ang kanilang dahilan kung bakit ayaw nila ng mga automated in clinical microscopies because it's the only test that can be performed done in a conventional way. So, kung i-manual mo, kung i-automate mo pa siya, parang nawawalan na ng alam, no? Masyado na nagre-rely ang mga medical technologists. Shit. That's one of the justification of a medical director or I'm sorry, laboratory manager na nakiusap in the past, no? During my visit sa interns natin. Sabi niya, sir, I decided to decline the use of automated analyzer in clinical microscopy kasi magiging dependent na lang ang aking mga medtech. They will forget how does the RBC looks like under the urine. They will forget how does the CAOX looks like urine in the microscope, under the microscope. It's one of the reason no, kung bakit yung test naman medyo nagkakaiba-iba yung result. Kasi magkakaiba tayo minsan ng basa. No? Yung iba, instead of having 10 fields, yung iba kapag nakakita ng 2 to 3 or 2 to 0 to 2 0 to 2 RBC, kahit pa nakakadalawang HP, nakakadalawang field pa lang yan, yun ay i-report niya. That's the variation. And that's one of the advantage of automation. It minimizes the variation among laboratorians. Pwedeng sa kanya, 2 positive. Pwedeng sa akin, 1 positive lang. Okay? Next, eliminates potential errors of manual analysis. So I will not go deeper on that. It's a self-explanatory one. And then we have here instruments use very small amounts of samples and regions. No? Unlike in manual one, you have to have 1 ml of sample, 0.5 ml of the sample. No, if you only have 1 ml of the serum, we have to collect it. Yes, of course. If you have to perform a lot of tests. Okay. Now, what are the basic approaches of automation? We have the continuous flow, We have the centrifugal analyzer or analysis, and we have the discrete analyzer. Before I proceed to the difference between these three, I want you to take note that these three can use batch analysis. No, these three are capable of what we call batch analysis, and we said batch analysis, a larger number of specimens can be done, or can be run, or can be tested in a one run. Okay, so now let's go to continuous flow. When we said continuous flow, it uses or it pumps the liquid through a system of continuous tubing. No? And this liquids pertains to the reagent, the humans, or samples used in the analysis. Right? And again, take note that samples are introduced in a sequential order. Again, remember people that continuous flow resolves uniformity in the performance of tests because same sample follow the same run. No? And take note that continuous flow allows many samples requiring the same procedure. Eh kahit pa, kagaya na sinabi natin kanina, si AA, si auto analyzer is capable of performing 40 samples per hour, per single run. Now, what is the problem? Again, the problem in continuous flow is the waste of reagents, no? And nagkakamain po tayo ng tinatawag nating K method. Next in line is we have the centrifugal analyzer or the centrifugal analysis. No, the force of the centrifugation transfer the and contains the liquid. Okay, take note that centrifugal analyzers or analysis uses cuvettes. And one of the major advantage of this centrifugal analysis is the batch analysis. Okay, next in line is we have the discrete analysis, which is the separation of each sample and reagent in a separate container. No? And again, take note that discrete analyzer or discrete analysis offers random access or stat capabilities, kagaya po nung sinabi natin kanina during in the past few slides. And take note, people, that this discrete analyzer is the most popular and the most versatile analyzer nowadays because of its sophisticated features. Now, what are the steps that we have to consider in automated analysis? Definitely, patient preparation and identification still in the list. Like what we have said in our in the previous slides, we have the three phases of analysis. We have the pre-analytical phase, the analytical phase, and the post-analytical phase. Specimen preparation and identification falls under the pre-analytical phase. That's correct. Okay. Typically, the patient preparation is manual. No, I haven't encountered any hospital, or I don't know any hospital here in the Philippines that offers patient identification in a robotic manner, wherein the robot will identify the patient or the kiosk one, like in McDonald's. No, the if you have to perform test, you just have to click anything in the board in the screen, and then the test will be done after mo magbayad. Wala pa po akong nakikitang ganun. The reason why specimen preparation still in a manual way. However, it can be done in an automated way by robotics. Pero kagaya nga ng sinabi ko sa Pilipinas, wala pa po tayong nakikitang robot na nagsabi ano po ang test na ipagagawa mo, ikaw po ba si patient ganito? Wala pa naman, no? Tumawa ka. Alam kong natawa ka. Now, specimen preparation can be skipped if full blood is used for analysis. Ay hindi pa kailangan siyang centrifuge kasi whole blood ang kailangan mo. Usually, whole blood ang ginagamit sa mga uh, I want to make it clear, usually, no? Or depending pa rin kasi yon sa sample or sa machine na gagamitin mo. In my experience as a medical technologist in the hospital, okay, we use whole blood in troponin I. So hindi mo na siya kailangang i-centrifuge. Hindi mo na kailangang i-separate ang plasma sa red cell kasi ang kailangan mo ay full blood. Okay? The answer in the call kung bakit medyo matagal is centrifuge ang ating mga samples since serum is the most commonly used sample in the clinical chemistry section is we can use the plasma separator or the gel separator one. No? And the primary tubing sample performed with heparin plasma. Again, yung pong ating mga SST or serum separator tube no, will allow us no, to separate the serum and the red cell. Merong gel na magsa-separate sa serum at saka sa red cell. Now, if you were able to centrifuge samples using the SST, after the centrifugation, the gel that can be located at the bottom of the container will be found at the middle of the serum and the red cell. And the principle of that is the passage of red cell in a gel like that, no, so that the serum and so that the serum will be isolated or will be separated from the red cell. Okay, specimen identification can be done in a manual label or halimbawa hindi ka pa barcoded, wala ka pang LIS. Paano mo malalaman yung specimen ano mo, identification? Yung kagaya ng sinabi ko sa inyo in our synchronous session, Rock 1, position 2, yung mga ganun, can help us. But you have to take note kung sino yung nilagay mo doon. Kasi kung hindi mo tatandaan at wala ka pang labeling system, it will be too hard for you to take note kaninong result yan if you are doing a batch testing. And we have another technique no, using the laboratory information system, kagaya po ng pinakita ko sa inyo sa ating discussion ng synchronous session tayo, meron po tayong barcode label. No? This barcode includes the demographics of the patient, okay? The test to be done of the patient, at saka kung ano po yung mga uh, details, no? Diagnosis ni patient. So, mas madali na. No? Our machine, i-read na lang na yung barcode. Meron pong mga barcode scanner na yung mga machine para malaman kung ano yung test na gagawin. How about for specimen measurement and delivery? Okay, we have a circular carousel or a rectangular rack. Ito po yung sinasabi ko sa inyo, wherein you are going to hold your specimen container. It can be cuvette or it can be the test tube itself. Okay, the primary collection tube or micro sample tubes are placed in the carousel or rack. Now, when we said aliquot is the measured through aspiration of a sample into a probe. So, ano pong ibig sabihin yan? I will show my whiteboard so that you will be able to know ano po bang ibig sabihin ng aliquot na yan. When we said an aliquot, no, this is one of the principles ng ating mga machine. So we load sample, no? We load the tube. What's happening? Yan. We load the tube in the machine. Or let's say for example, this is in rack 1, position 1. Yan. Usually yung mga rack may label naman siya. Something like that. It can be A, B, or 1, 2, 3, depending on the manufacturer. So let's say this is our rack 1. Now rack 1, or you can write A1. Mean to say rack 1 position A. So this is our sample. Ano po yung sinasabi natin na aliquot? Our machine is capable of what we call aliquoting. From this sample, kukuha lang siya ng microsample, no, using the probe na hindi mo dapat mabali. Yan. Using the probe, no, aspirate sample, and will be transferred into a cuvette. No? This will be transferred, the aspirated serum will be transferred in the cuvette. Okay? And this sample will be used for the analysis. So dito na rin po ilalagay yung ating tinatawag na reagent if we have the wet chemistry. Okay? So aliquot is a measured through aspiration of sample using a probe. Okay? Next is probe and tubing are cleaned after each dispensing to minimize the carryover. The reason why, if you see in your machine or on the display screen of your machine na nakalagay doon rinsing, ibig sabihin, nagke-cleanse siya or naglilinis po siya ng kanyang probe, no? Para po ma-eliminate ang ating carryover. Now, kagaya po ng sinabi ko sa inyo, Vitros uses disposable probes or disposable microtips per sample, per test, per specimen. Okay? Pero kung wala at probe ang ginagamit, no, kailangan mo nang i-rinse yan ni machine to eliminate the carry over. Now, how about for reagent systems and delivery? We have the liquid, no, which is available in bulk, volume containers, or unit doses. So, kung saan mo ito mabibili, ay doon lang po mismo sa iyong supplier. And we have the dry chemistry, no, which uses the lyophilized powder or lyophilized serum. And then you have to reconstitute it, no, using the prescribed diluent. Sometimes meron po silang mga diluent na binibigay, no? Pero yung iba po ay wala. Okay? Pag walang binigay na diluent, ibig sabihin, you can use distilled water as the solvent, no? To dilute your lyophilized sample. Now, how about for refrigeration? Now, people, gusto kong tandaan nyo na yung ating pong chemistry section, sa chemistry section po natin, hindi po natin nire-refrigerate ang serum. Okay? Do not refrigerate serum. Ay, sir, ba't nakalagay dyan? Refrigeration. Uh, refrigeration for whole blood. Okay? Kapag refrigeration, then it should be whole blood. At kapag whole blood, example ng ating vacutainer is the EDTA. Now, how about for serum? Since serums, diba sabi natin si serum, yung ating most commonly used sample in chemistry, serum must be preserved, no, in uh, freezing point, freezing temperature. I'm sorry, ano freezing point ka dyan? Temperature. Okay? Bakit po? No, bakit kailangan freezing temperature? To preserve the specimen. Kasi, for example, glucose or the glucose. If you refrigerate a whole blood, no? If you refrigerate a whole blood for glucose analysis, do you think that the glucose will be preserved? No. Hindi po mape-preserve dyan ang glucose kahit na refrigerate mo siya. Bakit? Meron pong mga red cells dyan. Kasi whole blood yan. Yung pong mga red cell po ito, hindi po itlog. Hindi sunny side up egg. Yung pong mga RBC natin, no, ilalagay ko ng label, baka pag nag-aaral ka, nakita mo to, sabihin mo, itlog yan. No? Yung pong RBC, since meron pong tayong RBC, require yan ng energy. At para mag-require yan ng energy, ano yung energy ang kukunin niya? Yung glucose na nandoon sa environment o doon sa in vitro, not sa tube. So kung nandun yung glucose, mag-metabolize yan. And take note, pag na-metabolize ang glucose, nagkaroon ng glycolysis, bababa ang glucose. Eh, ang test mo, glucose analysis. Eh, kasi ni-refrigerate mo eh. No? Take note, kapag po mga gantong bagay, dapat po siyang i-freeze. Although, meron tayong mga tinatawag na cold factor and hot factor. Or, meron po tayong mga hot labile and cold labile. Most especially enzymes, no? Ang temperature, importante kapag kay enzyme. So, huwag nyo masyadong isipin. Darating po tayo dyan. Now, binibigyan ko lang kayo ng overview. Now, going back, yung glucose kasi kapag in-store mo sa refrigerated temperature, ang sabi natin, since meron dyang RBC, hindi pa nasa-separate ang RBC at ang red cell, ang RBC at ang serum, no? May magre-require ng energy dyan. At dahil may nagre-require ng energy, no? At dahil may nagre-require ng energy, yung glucose na nandun available sa red cell bababa. Take note guys that the glucose metabolism Okay, so sulat natin ng maganda. Glucose metabolism at refrigerated temperature is 2 mg per dl per hour. Ganon, no? Ganon kadami or ganon kalaki ang na may metabolize. 2 milligram per dl per hour. So nababa siya. Kapag naman nasa room temperature lang siya, no, pag nasa room temperature, 7 mg per deciliter per hour. Ano po yung palatandaan dito? Mayaman ka. At dahil mayaman ka, meron kang 7 na room. At bawat room mo, merong dalawang ref. Okay? Take note. Glucose metabolism at room temperature is 7 milligrams per deciliter if the red cell in this room is not separated. Glucose metabolism at refrigerated temperature is 2 milligrams per deciliter per hour if not separated. So, ano palatandaan mo? Nayaman ka, meron kang 7 na room, at yung 7 mong room, merong dalawang ref. Okay? So, that's how you understand, remember that. Okay? Dispense via tubing, no, yung ating mga reagent ay dinidispense na via tubing, continuous flow, continuous flow. Hindi na kagaya dati na you have to dispense one by one, manual by manual, isa-isa, no, mahirap. And minsan nga, dahil nakikipagdaldalan ka sa katrabaho mo, nalilimutan mo na kung saan nilalagyan mo. At minsan out of out of mind ka, hindi mo na alam kung saan ka nandun. Then you have to do it again. Sayang yung reagent. Okay? So this is an example of a multi-layered dry chemistry slide, no? Used, I'm sorry, I am not sharing pala my uh, presentation. Multi-layered dry chemistry slide, no, used by Vetros, which is also known as the orthodiagnostics. Now, how about for chemical reaction phase? So we have here mixing. Mixing is mixing stands for the reagent and the sample. No? Mixing can be done through coiled tubing, continuous flow analyzer, yun ang ginagamit nila. Rapid stop of reaction tray, no, RA1000. Rapid stop of the rotation or bubbling of air, that is what we call the centrifugal analyzer. Okay? Separation is done by separating undesirable substances from the sample. Okay? Incubation, heating bath, water or air to maintain required temperature of the reaction time. And reaction time depends on the rate of the transport through the system and time reagent additions. Okay, so now we have here in the automated analysis or in the measurement phase. Now, the measurement phase includes the system of measurement. It can be the ultraviolet, fluorescence, or flame photometry, iron-specific electrodes, gamma counters, luminometers, or visible and ultraviolet spectrum, which is the most common, and of course the fluorescence, polarization, chemiluminescence, and bioluminescence, which we are going to discuss, no, in the next learning video. Okay, so signal processing and data handling. Okay, the accurate calibration is essential. Bakit kailangan yan? Bakit kailangan ang accurate calibration? To maintain the integrity of the machine, to maintain the reliability and accuracy of the result. Okay? Multiple instruments that measure the same constituent in the lab should be calibrated so that the results are compatible. Okay? Automated instruments, once calibrated, provide long-term stability and standard curve. Kagaya na sinabi ko sa inyo, yung 2SD, 2SD, no? Positive 2SD. Pag nasa negative 3SD ka na at uh, positive 3SD ay siya anak. Kailangan mag-control, kailangan ayusin. Baka hindi pasok ang control. Okay. Advanced automated instruments have method of reporting printed results. Ito na yung sinasabi ko sa inyo. Instead na magdi-display lang siya sa screen, isusulat mo, or you will have the thermal paper, meron ka ng printed results by provided by your machine. And computerized monitoring is available for many parameters, like for example the use of laboratory information system. Now, what are the things that we have to consider in selection of automated analyzer? Number one is the rate of instrument according to the previously identified needs. Alam ka namang bumili ka ng napaka high-end na laboratory equipment or machine or analyzer na yung census mo naman, yung number of tests naman na pine-perform mo for a specific day ay hindi naman ganun ka-significant. Remember, matagal ang return of investment kapag ganun. So you have to consider first the rate of instrument to the previous identified needs. Do we need to automate FBS? Aba, ay kung sa panahon ngayon at ang FBS mo ay semi-automated pa din, ay mag-isip na ang laboratoryong pinagpupuntahan mo. Okay? Consider not only the cost of instrument but the consumables. Meron kasing mga machines na at first glance, tinutuwan-tuwa ka, oh, it only cost 1 million. Ang mura, 1 million. Saan ka makakatala at makakakita ng 1 million chemistry analyzer? Kaya pala 1 million ang bawi doon sa mga consumables. And you don't have any choice but to buy this consumable sa inyong supplier. So, luto ka sa sarili mong mantika. Okay? Yun yung ibig sabihin ng consider not only the cost of the instrument but the consumables. Kaya yung doon mo tatanong, aside from how much the machine cost, ang sunod mong tanong alin? Yung kanyang consumables. Kasi yung machine, one time, big time. Isang beses mo lang siyang bibilihin. Hindi mo naman siya bibilhin every day, every month. Hindi ka naman papalit ng machine every day. No, yung mga control mo, yung mga tips mo, yung mga ginagamit mo sa iyong machine, yun yung binibili mo almost every day. Yun yung pinapalitan mo almost every day. And if this costs you too much, then it is not recommended na yun yung bilhin mo machine. Ay consider total cost per test of each instrument. Kaya yung mga laboratory, nagagawa sila ng cost analysis or cost accounting. Ganito kalaki yung test, ganito kalaki yung machine, ganito kamahal yung machine na binili natin. How much yung pababayad natin per test? Kasama po yun. No? Kaya pag kayo ay naging chief medical technologist na or naging medical technologist or section head, you have to consider also which machine you will recommend. Na ano lang yung masakit doon, may nirecommend ka na yun yung bilhin, pero hindi yun yung binili ng management. Ang binigay sa iyo ng management yung poor quality. Then they will ask you to give a more reliable result. Kamusta naman yun? Okay? Perform break-even analysis on relationship of fixed cost and variable cost and profits. Ito yung sinasabi ko sa inyo. At the end of 3 years, at the end of 2 years, dapat naka-break even na tayo doon sa cost na binili natin ng machine. You should have a knowledge on that. Factor in mode of acquisition. Okay? Purchase ba yan? Rent ba yan? Lease ba yan? Pahiram ba yan? Or what? I don't know if I was able to mention this to you because there are some manufacturers or distributors ng machine pero yung machine pinagagamit nila sa mga innovation. Siyempre, yung mga Reagent, yung machine wala kang bayad. After 1 year, at efficient, maganda ang result ng machine, then saka mo siya balik-balik. You have to consider that. So, consider the analytical capabilities of the instrument. Alam ka namang 10 beses ka na na-control in a day. Pero until now, hindi mo pa rin na papasok yung control. No? And observe instrument in operation and for trial basis. Siyempre, bago mo yan bitihin, papatayin sa'yo for a month, for a day, for a week. And you have to make a observation. Things. Okay? Now, for total laboratory automation, again, we have the pre-analytical, the post-analytical, and analytical itself. Pre-analytical phase is also known as the sample processing. Again, automated process is replaced manual handling. Okay, what are the key concepts of pre-analytical phase? You have the conveyance system, the barcoded specimen, mas madali nang makikita, malalaman kung ano yung test, computer software package. So the result, no, the specimen movement is seen. Mas ano tayong specimen? Anong specimen ang ang tinetest niya? Nakikita po yun doon. Coordination of robots with instrument as work cells and automated sorting, centrifugation, capping, sample, and touching. We have here a total laboratory, total automated automation. Uh, I don't know if you were able to watch the videos that I've uploaded in our learning management system entitled Knowing Your Clinical Chemistry Analyzer. There is one analyzer, I think that is Cobas. I don't know, I forgot that specific brand of the analyzer that is capable of performing the what you call this sample preparation. Just have to load your tube, no? Kung siya ay syrup, eh siya nang bahala mag-centrifuge din sa loob ng machine. This is an example of pre-analytical automated system. Yung mga malalaking machine, yun po yung pre-analytical automated na yung machine. How about for analytical phase? Analytical phase includes or also known as the chemical analysis. And this includes very smaller microsample expanded on board total test menus. Yun yung test mismo, no? Na mayroong mga iba't ibang principle on how to do the test. And take note, no, that it should be ergonomically and physically designed improvement. And of course, dapat user-friendly. User-friendly interactive software for quality control and maintenance. Because aside from you know how to operate the machine itself must be friendly to you so that it will be easy for you to run the control and to do the maintenance. Now, I don't know why it's not included on the factors that you have to consider in automation. Yun yung isang factor na dapat natin tandaan, the maintenance of the machine. Okay? Post-analytic phase includes the data management. How are we going to release the result? Automated management of quality control data para mas mabilis yung what you call this, mas mabilis yung pag-gather, pagkuha ng data, pagkuha ng sample, pagkuha ng result. Okay? User-defined perimeters for many values. Now, used for gap filler between instrument and laboratory information system. Now, what are the future trends in automation? More integration on and miniaturization of concepts and systems. More sophisticated, portable analyzer. Kaso lang may mga problema sa mga portable analyzer, ang dali nilang masira. At kapag nasira sila, kailangan mo nang bumili ng bago. New tests for expanded menus. Spectral mapping, multiple wavelength monitoring, and high resolution photometers in analyzers. Okay? And extensive use of mass spectrometry and capillary electrophoresis, which is much more efficient. And lastly, the system and workflow integration with robotics and data management. Hindi porket sinabi natin robotics, ito na po yung mga robot. So, when we said robotics, is the instrumentation na gagamitin natin to have our results na mas mabilis. Okay? So, thank you for listening. I hope I was able to discuss it with justice about the principles of automation. The the what you call this? Sige, Mark, you can do it. Uh, the discussion of each principles, no, like the chemiluminescence, will be discussed in our next videos. Okay? So once again, this has been Sir Mark, and I hope you learn and enjoy this learning video.